Hello, this is Justine Kesterson. I'm doing the most common injuries in women's soccer. And for the first one, I have torn ACL. And the ACL is the anterior cruciate ligament. It's in the knee that attaches the front of the tibia with the back of the femur and functions especially to prevent hyperextension of the knee. A torn ACL occurs when the sudden change in movement or pivot of the ligament against a locked knee. The ACL is most commonly torn in the result of a quick deceleration, hyperextension, or rotational injury that usually has no contact with another individual or athlete. Tearing of the ACL usually occurs following a sudden change of direction. Usually a popping sensation will occur when the ACL is torn. Two of the tests that can be done to check to see if you have torn your ACL is the Latchman test and the anterior drawer test. For an ACL tear, there's only one ligament that is injured that we are talking about here today, which is the ACL. But when an ACL tears, there can also be more ligaments that are torn with it, which might include the PCL, the MCL, LCL, and also the meniscus, and which is meniscus tears most commonly with the ACL. The next most common injury that I have put is head injuries. One of the most, which is a concussion that I have done. A concussion is a traumatic brain injury that occurs by a blow to the head or another body part that jars or shakes the brain inside the skull. You don't have to pass out or lose consciousness to have a concussion. The MOI for a concussion consists of direct blows to the head. Although helmets are worn to prevent head injuries such as concussions, the highest rate for concussions occur within the sports that have helmets. With head injuries such as concussions, they may not experience any signs or symptoms right away. And some symptoms to look for concussion are dizziness, most often than not sensitive to the light or noise, irritability, abnormal mood swings, problems sleeping, issues tolerating stress, experiencing more long-lasting headaches, and more. The muscle or injured body part here is the brain. The skull can be injured or fractured when a concussion happens, but most of the time it doesn't. It's just the brain that gets injured. One of the things that you can assess a concussion is a CAP scan, and also for athletic trainers to assess an athlete, they usually use like questions, 15 to 20 questions that they go through and ask the athlete. They do balance testing, light testing, and to see if they have a concussion. And the last injury that I have for our project is muscle tear or strain. And I put a groin strain, which is one of the most common injuries that happens in women's soccer. A groin strain is the tear or rupture of any abductor muscle resulting in pain of the inner thigh. The injuries can be very mild or they can be very severe. One of the most common ways the groin gets strained or torn is forceful abduction of the thigh during intentional adduction. Overstretching can also strain the groin, but it's not as likely as intentional adduction. The groin consists of many muscles in the inner thigh, and those muscles are adductor longus, adductor mingus, and gracilis. There aren't very many, there isn't really a test to test if you have torn your groin, but one of the things they do assess is the pain that the athlete is enduring, and that will give you a good idea if you have torn or strained your muscle or groin.